I'm Dr. Perry Gadalovich, and in this video I'm going to be reviewing the consent form for rhinoplasty. Rhinoplasty is the medical term for a nose job. It includes the outer part of the nose as well as the inner part of the nose, which is called the septum. This procedure is done under general anesthesia when we're doing bony work as well, in order to prevent pain when we're breaking the bone, in order to bring the nasal bones in. The risks of general anesthesia today are less than driving in a car, but there is a risk of thrombophlebitis, which is clotting in the legs, for which we give you socks and compression socks in order to prevent, as well as the risk of nausea and vomiting, for which we give you medications. The risks of a rhinoplasty include multiple things. One is dryness of the nose. The other is a problem with the septum, so it can, even if we're trying to correct the deviation, it can re-deviate because cartilage is an alive part. It can cause a perforation on the inside, meaning if there's too much trauma to the septum, there can be a small hole left in there. On the outside of the nose, there can be swelling of the tip that can last up to a year, bleeding, which is normal in the first 24 to 48 hours, but can persist, as well as contour deformities on the nasal base and asymmetries. The scar is typically right in the columella, and the decision of whether or not to reduce the nostrils is taken on the operating room table, so a small scar at the base of each nostril is also possible. I've never seen infection, but although it is possible, and we do give antibiotics to prevent this complication. The nose will feel numb, and you can have some nasal congestion that can persist for almost a month, and this is normal after this surgery.